Hello everyone, our paper is titled Personalized Persuasive Technology for Maternal Healthcare in Nigeria. My name is Mark Wachinkwo and I co-authored this paper with Charity Mbanisi, Rita Oji and Virginia Ejiofor. We structured our paper as follows: motivation, goal, research method, results and mapping of results to persuasive strategies, proposed design guidelines, study status, highlights, and conclusion on future work. More than 500 women, mostly from Africa and between 15 to 49 years of age, die of causes related to pregnancy and childbirth. Local caregivers have used conventional approaches to persuasion to motivate pregnant women to embrace healthy lifestyles, such as traditional media, cultural and community meetings, TV, newspaper, etc. However, these efforts have not been effective, and so there are ever-increasing incidences of absenteeism, non-adherence, and ignorance about the essential maternal health care behaviors and practices among local women. These developments ultimately lead to the constant health crisis of these women, delivery of newborn babies with serious health problems and deformities, and increase in pregnancy and childbirth-related deaths among the people. Therefore, the goal of this study is to uncover the obstacles to adopting appropriate maternal health and information-seeking behaviors among expectant mothers. The results will be carefully mapped to their corresponding persuasive strategies. These persuasive strategies will be employed to design and implement a personalized persuasive technology which will potentially promote proper and timely health and information-seeking behaviors among expectant mothers and nursing mothers as well. We believe that inspiring expectant and nursing mothers to embrace proper health and information-seeking behaviors could substantially improve their health and that of their unborn and newly born babies. We employed a mixed method in this study. They include a survey, that's a questionnaire. We collect and analyze user perceptions to get results which could be mapped to definite system requirements. System design using object-oriented analysis and design model to model and implement the artifact. Then we're going to use persuasive system design, that's the Fox model and the PSD framework. The relevant persuasive strategies from these models will be implemented on the system model. They provide the behavior change strategies which could support users to perform target behaviors. In our initial study, we conducted a user study of expectant and nursing mothers and caregivers after the first 3 months of their antenatal visits, that first trimester. We weighed up our questionnaires using the participant agreement to a 5-Likert scale ranging from 1 to 5. We had 70 respondents in our study. This was done to find out the factors that affect the adoption of appropriate maternal health and information-seeking behaviors among these women. Here we use the Fox 8-step process to design a persuasive system to analyze the present approach in order to provide new ways of promoting proper maternal health and information-seeking behaviors among expectant and nursing mothers. Fox designed 8-step process to building persuasive technologies, and they include: 1. Target a simple behavior, know the target audience, discover obstacles to performing a target behavior, use technology familiar to users, identify appropriate persuasive technology examples, emulate effective examples, evaluate and repeat fast, and then expand on success. Here, we employ the socially oriented strategies of the PSD framework to implement the behavior change displays which we hope could motivate system users, that's the potential users, to perform target behaviors. They are social learning, which is supposed to allow users to learn and see from what others are doing. Social comparison, which is supposed to allow users to compare their performance with that of others. Normative influence, which is supposed to motivate users via peer pressure or peer experiences and performances as the case may be. Recognition, here it will offer public recognition to users for performing target behaviors. And then personalization, which provides customized content and services to potential users. Now, the result from our initial study uncover the factors that affect the adoption of proper maternal health and information-seeking behaviors among expectant and nursing mothers. These factors include religious and cultural beliefs, aversion to cesarean sections, high hospital bills, poverty, outright ignorance, lack of time, and carelessness. In addition, the results show that participants make use of mobile phones and computers, while some have internet access. This result is significant because it opens up opportunities for designers to adapt essential interventions on technologies familiar to potential users. We mapped participants' responses to their corresponding persuasive strategies. Very significantly, the responses from the participants captured in the previous slide could be tackled via the implementation of social support strategies. Therefore, we mapped them to the relevant social strategies such as the social learning, social comparison, normative influence, and recognition. These socially oriented strategies will be used to personalize maternal health contents and services to expectant mothers and nursing mothers alike. Specifically, we propose to implement these social support strategies in our system. First, the social learning. We plan to operationalize social learning display to show a personalized and graphical display of the number of pregnant women and the points earned for frequent and timely attendance to antenatal sessions each month. We expect that the display will help to model the attitudes of pregnant women towards the antenatal care visits and support them to adopt positive maternal health care behaviors. Social comparison. We plan to operationalize this strategy via an instant messaging component, which will allow users to share and compare information related to their maternal and child health. The user of the system will see a display of our own maternal health care progress information shared on the app and that of other registered users with pseudonyms. The display will be limited to like 7 users per screen to make it easier for the logged-in user to see and compare her performance with that of other expectant mothers registered in the system. The user will also have the opportunity to send personalized feedbacks, that's reactions, using any of the 3 keys, OK, surprise, and oh no. The app will be automatically updated with new records such that users could have the opportunity to compare attendance as time progresses. Normative influence. Expectant and nursing mothers will use their mobile devices to view pictures of newborn babies with serious health problems and deformities due to the mother's inability to attend antenatal care frequently and timely. We hope that this display will awaken their consciousness on the dangers of absenting or irregularly attending antenatal care. Also, we plan to use this display to encourage the delivery and receipt of essential maternal health care services such as malaria treatment, immunizations, and health counseling. Besides, since our proposed system is going to be an integrated platform, mobile and desktop system, we plan to ensure that the aforementioned displays are also shown on a public LCD located in a strategic location in the antenatal section of the maternal health care facility where everyone can see it. Recognition. The system will allow users to view through their mobile devices a list of expectant mothers who have regularly attended antenatal visits over a given period and have successfully performed assigned target behaviors. The system will also publish personal success stories of successfully delivered mothers and what they did to achieve that feat. Again, since our proposed system is going to be an integrated platform, we plan to ensure that recognition displays are also shown on a public LCD located in a strategic location in the antenatal section of the maternal health care facility where everyone can see it. Progressively, the list will be automatically updated using attendance points entered for each user after 3 months calculation of how frequent and timely are the antenatal visits of these pregnant women. And for the personalization strategy, the system will provide a unique identification number to the women at the point of registration. This, the user, will be used to receive and access personalized services. This interface will show contents that are pertinent to the expectant mothers. For example, through personalization, The logged-in user can be able to envisage and compare her attendance to that of other women performing the same task. She can equally react by using any of the three keys: contented, astonished, or discouraged. We are currently at the design phase of this research work. We are using the Fox persuasive design steps to develop our artifacts as follows. Target a behavior. The behavior we are targeting is to motivate ANC and postnatal visits at local maternal health care facilities. Who are the audience? That's the expectant mothers and the nursing mothers. Obstacles to performing target behavior. We found out that religious and cultural beliefs, aversion for cesarean sections, high hospital bills, poverty, outright ignorance, lack of time, and carelessness are those factors that hinder proper maternal health care information seeking behavior. Then, familiar technology. We also found out that mobile phones and computers, as well as internet access, are some of the facilities that users or the potential users use, and this is so important and significant because we could adapt our intervention to fit in or to be used through those devices. We identified appropriate examples by reviewing designs by other researchers such as Nkwo et al. Nkwo et al. Actually designed a personalized persuasive system for promoting clean and sustainable environments. Therefore, we emulated that example to design our own artifacts. The other two steps, that's the evaluate and repeat fast and expand on success, will be done in the course of our design. Here are the highlights of our research. We uncovered that religious and cultural belief, aversion to cesarean sections, high hospital bills, poverty, ignorance, lack of time, and carelessness are some of the factors that affect the adoption of proper maternal health seeking behaviors among expectant and nursing mothers. We mapped our findings to their corresponding persuasive strategies and described how we will implement them in our design. We employed the Fox persuasive design steps to start off the development of our integrated app for maternal health. We will implement all the relevant persuasive strategies in the course of the design. In conclusion, persuasive strategies serve as building blocks to persuasive technologies. Persuasive technologies are interactive systems which are designed for the primary purpose of motivating, inspiring, stimulating, and encouraging people to change their behaviors without using coercion or deception. Based on the findings of our initial study, we are iteratively developing a persuasive technology for maternal health which will offer diverse but personalized persuasive displays that will potentially support and inspire expectant and nursing mothers to perform target behaviors in collaboration with caregivers. In future, we plan to conduct a usability evaluation with individual users to get feedback about the effectiveness of the app. Again, we will compare our findings against the current maternal health care practices to show its obvious benefits. And here are a few of the literatures we reviewed for our study. Thanks for viewing. Did you enjoy our presentation? Please show us some love.